Incruse ellipta. Umeclidinium. How to use. Uses. Umeclidinium is used to control and prevent symptoms, such as wheezing, shortness of breath, caused by ongoing lung disease, chronic obstructive pulmonary disease (COPD), which includes bronchitis and emphysema. It works by relaxing the muscles around the airways so that they open up and you can breathe more easily. Umeclidinium belongs to a class of drugs known as anticholinergics. Controlling symptoms of breathing problems can decrease time lost from work or school. This medication must be used regularly to be effective. It does not work right away and should not be used to relieve sudden shortness of breath. If wheezing or sudden shortness of breath occurs, use your quick-relief inhaler, such as albuterol, also called salbutamol in some countries, as prescribed. How to use. 1. Inhale this medication by mouth as directed by your doctor, usually once daily. 2. Do not open the cover of the inhaler until you are ready to use it. 3. Each time you open the cover, you prepare a dose of the medication. 4. If you open and close the cover without inhaling the medication, you will lose the dose. 5. To avoid wasting a dose, do not close the cover until after you have inhaled the medication. 6. You may or may not taste, feel the drug when you inhale. 7. Do not exhale into the device. 8. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time every day. 9. Do not use it more than one time each day. 10. Do not increase your dose, use this medication more often, or stop using it without first consulting your doctor. 11. Your condition will not improve any faster, and your risk of side effects will increase. 12. If you are using other inhalers at the same time, wait at least 1 minute between the use of each medication. 13. Ask your doctor ahead of time what you should do if you have new or worsening cough or shortness of breath, wheezing, increased sputum, waking up at night with trouble breathing, if you use your quick-relief inhaler more often, or if your quick-relief inhaler does not seem to be working well.